Introduction. Non-invasive neurostimulation represents a significant advancement in the treatment of neurological conditions, offering methods to stimulate the nervous system without breaching the skin. These techniques utilize modalities such as electrical, magnetic, or alternative stimuli to modulate neural excitability and networks. While non-invasive neurostimulation has demonstrated effectiveness and safety in treating certain neurological conditions in humans, a substantial challenge remains because of the considerable variability in individual responses to these interventions. This variability stems from a lack of standardized stimulation protocols, inherent biological differences among individuals, and the specific neurophysiological states of the targeted neural regions. The field of non-invasive neurostimulation is characterized by time-intensive research and a need for meticulous planning. Despite these challenges, such research is critical for the development of more effective therapeutic protocols, optimization of stimulation parameters, and enhancement of neurostimulation outcomes for diverse neurological conditions. Among various non-invasive neurostimulation techniques such as transcutaneous vagal nerve stimulation, transcutaneous electrical nerve stimulation, and transcranial direct current stimulation, repetitive transcranial magnetic stimulation has emerged as a prominent modality in human and veterinary medicine research. Repetitive transcranial magnetic stimulation attracts considerable scientific attention for its potential application across a broad spectrum of neurological disorders. In veterinary medicine, non-invasive neurostimulation is still in its early stages, with a limited number of studies reporting its use in managing seizures and behavioral problems in animals. This article explores the mechanisms, applications, and challenges associated with non-invasive neurostimulation, with a particular emphasis on repetitive transcranial magnetic stimulation in both human and veterinary contexts. Mechanism of action. Transcranial magnetic stimulation is a non-invasive neuromodulatory technique that relies on the principles of electromagnetic induction to generate an electric field within the brain. The method involves placing a magnetic coil near the scalp. This coil projects a magnetic field through soft and bony cranial tissues, effectively converting the coil's electrical current into an induced current pulse within neural tissue. These currents can activate cortical neurons at depths of approximately 1.5 to 3.0 centimeters. However, the penetration depth is affected by stimulus intensity, coil design, and the thickness of intervening tissues. There are different ways to use transcranial magnetic stimulation. Single-pulse transcranial magnetic stimulation is used to evaluate the brain's excitability. Paired-pulse transcranial magnetic stimulation is used to examine connectivity between different parts of the cortex, and the dynamics of inhibitory and excitatory mechanisms within the cortex. Repetitive transcranial magnetic stimulation, however, is employed for therapeutic interventions because of its ability to induce long-lasting changes in brain activity, even after the stimulation has ended. The effects of repetitive transcranial magnetic stimulation can be either excitatory or inhibitory, depending on the frequency of the stimulation. Repetitive transcranial magnetic stimulation not only affects the targeted cortical region, but also influences distant areas that are connected anatomically and functionally. In the context of epilepsy management, repetitive transcranial magnetic stimulation is strategically applied to modulate activity within focal epileptogenic zones or more widespread epileptogenic networks. In canine models, precise localization of epileptogenic zones is still not developed fully, thus treatments typically focus on modulating the activity of broader networks. The primary effect of transcranial magnetic stimulation is seen in the cortex because the magnetic field decreases quickly with increasing distance from the coil. This is different from invasive methods like deep brain stimulation, which can target subcortical areas directly. Consequently, repetitive transcranial magnetic stimulation may not directly affect subcortical epileptic networks unless the coil output is very strong or the cranial tissues allow for deeper penetration of the magnetic field. However, in some cases with small to medium-sized dogs, larger coils designed for humans can be used to stimulate both cortical and subcortical regions simultaneously. Unfortunately, there is a lack of advanced neuroimaging research that would allow researchers to accurately map the effects of repetitive transcranial magnetic stimulation in various canine breeds. However, repetitive transcranial magnetic stimulation can also influence subcortical regions through mechanisms like transsynaptic signaling and the induction of long-term neuroplasticity. The long-lasting effects of repetitive transcranial magnetic stimulation are mostly due to its ability to modulate synaptic functionality, especially by adjusting the equilibrium between long-term potentiation and long-term depression within neuronal circuits. These changes can profoundly impact different neural networks, influencing various physiological and pathological processes, such as cognitive functions including memory, learning, and behavior. Stimulation parameters. The optimization of stimulation parameters is critical for effective repetitive transcranial magnetic stimulation because they have a large impact on neuronal network modulation. The parameters include stimulation frequency, coil intensity, the number of stimulation trains and individual pulses within those trains, the duration of intervals between trains, and the overall length of the stimulation session. Coil intensity and stimulation frequency are particularly important because they have a direct effect on the therapeutic result. Lower frequencies of repetitive transcranial magnetic stimulation, less than or equal to 1 Hz, reduce the excitability of the corticospinal tract, while frequencies greater than 1 Hz increase it. The selection of the stimulation frequency depends on the specific neurological condition. For example, lower frequencies are preferred in epilepsy treatment because they depress neural excitability. Furthermore, research indicates that higher coil intensities, ranging from 70 to 90% of the maximum device output, lead to better therapeutic outcomes, including a significant decrease in seizure occurrences in patients with epilepsy. This is thought to be because higher coil intensity allows for a more profound stimulation of a larger volume of brain tissue. Before starting a repetitive transcranial magnetic stimulation treatment, it is important to determine the motor threshold. The motor threshold is the lowest coil intensity necessary to cause motor action potentials in a contralateral limb muscle, usually an arm muscle in humans and a forelimb muscle in dogs, during at least 50% of single-pulse stimulations. This threshold is different for each individual but tends to be stable within an individual. Determining the motor threshold is a foundation for developing a repetitive transcranial magnetic stimulation protocol. It helps clinicians and researchers decide the necessary coil output intensity to effectively stimulate a person's brain. Using insufficient stimulation could lower the likelihood of achieving the desirable clinical results. Conversely, excessive stimulation may affect a broader brain area and cause indirect activation of subcortical structures, potentially leading to unwanted outcomes. Theta burst stimulation, a new type of repetitive transcranial magnetic stimulation, is thought to modulate synaptic plasticity more effectively. Theta burst stimulation delivers high-frequency bursts at submotor threshold intensity, usually around 80% of the motor threshold. It can be applied in an intermittent or continuous mode. Intermittent theta burst stimulation is thought to increase cortical excitability, similar to traditional high-frequency repetitive transcranial magnetic stimulation, while continuous theta burst stimulation has a dampening effect like low-frequency repetitive transcranial magnetic stimulation. Both theta burst stimulation and certain high-frequency repetitive transcranial magnetic stimulation protocols are approved by the U.S. Food and Drug Administration for treating depression that is resistant to treatment in humans. Clinical use in human medicine. The capacity of repetitive transcranial magnetic stimulation to modulate neural circuits and functions non-invasively, with little to no adverse effects, makes it a promising therapeutic intervention for a wide range of neurological conditions. Over 15 years of research supports the use of repetitive transcranial magnetic stimulation as an antidepressant and for the treatment of some forms of migraine headaches. Evidence from numerous studies and ongoing research also indicates that repetitive transcranial magnetic stimulation shows potential for safe and effective treatment of movement and neurodegenerative disorders. However, more research is necessary for the formal approval and integration of repetitive transcranial magnetic stimulation into the clinical protocols for these conditions. Interictal repetitive transcranial magnetic stimulation is an emerging and safe method for managing people with epilepsy that does not respond to drug treatments. Meta-analyses have shown a decrease in seizure frequency, particularly among patients with cortical dysplasia and neocortical epilepsy, when low-frequency repetitive transcranial magnetic stimulation is used to target epileptogenic zones. However, the therapeutic efficacy of repetitive transcranial magnetic stimulation in drug-resistant epilepsy varies. The different outcomes may be caused by factors such as patient selection, potential biases related to study blinding, and the use of suboptimal stimulation protocols. Furthermore, preliminary studies have shown the beneficial impacts of low-frequency icto-repetitive transcranial magnetic stimulation in cases of intractable status epilepticus, expanding its potential therapeutic use. Clinical use in veterinary medicine. Research on repetitive transcranial magnetic stimulation in veterinary medicine is limited. One study examined a small group of canines with epilepsy and found that the interval between seizures was extended following stimulation compared to baseline measures. A double-blind, placebo-controlled clinical trial revealed a significant decrease in monthly seizure occurrences and the frequency of days with seizures among dogs receiving active repetitive transcranial magnetic stimulation compared to those receiving a placebo treatment. Subsequent analysis administering active repetitive transcranial magnetic stimulation to the placebo group, using the same parameters, showed similar improvements. The antiepileptic effect persisted for a median duration of 4 months, ranging from 2 to 10 months, without any observed adverse effects linked to the treatment. While these findings offer promising evidence for the application of repetitive transcranial magnetic stimulation for the treatment of canine drug-resistant epilepsy, larger studies are needed to confirm these results. Preliminary data suggests that dogs with drug-resistant epilepsy show favorable responses to active low-frequency repetitive transcranial magnetic stimulation compared to placebo interventions. High-frequency repetitive transcranial magnetic stimulation has been explored as a potential therapy for behavioral problems in dogs such as anxiety and aggression, with initial positive results. More research is necessary to confirm these initial findings. Future directions. A growing number of studies are exploring non-invasive neurostimulation techniques, especially repetitive transcranial magnetic stimulation, for their potential in treating a variety of neurological disorders in humans. It is important to recognize the limitations and current standing of the scientific domain to better direct future research. Currently, the clinical use of repetitive transcranial magnetic stimulation is approved for a limited number of neurological conditions in humans. More evidence is necessary to substantiate its efficacy and safety for a broader range of disorders, such as epilepsy, movement disorders, and neurodegenerative diseases. The majority of neuromodulation clinical trials have been conducted on patients resistant to pharmacotherapy. This limits the generalization of the findings to the broader patient population. Given the non-invasive nature and positive safety profile of repetitive transcranial magnetic stimulation, it is reasonable to conduct research on individuals who respond to medication in both humans and canines. Such studies could potentially reduce the need for multiple drug treatments and mitigate the risk of significant pharmacological side effects. Much of the current research in both human and veterinary medicine focuses on evaluating clinical effects, particularly a reduction in the frequency and intensity of seizures. While these outcomes are very important, the next crucial step is to explore the antiepileptogenic capabilities of non-invasive neurostimulation across various brain regions, and its impact on the underlying causes of disorders. The changes in brain function caused by neurostimulation and their relationship to clinical results can be analyzed using sophisticated neuroimaging methods. Such investigation will enhance understanding of repetitive transcranial magnetic stimulation, allow for more effective personalized treatments, identify optimal parameters tailored to specific pathologies, and identify who is likely to respond to the treatments. In veterinary science, access to advanced neuroimaging modalities lags behind that in human medicine. Therefore, using neuroimaging techniques to explore the effects of non-invasive neurostimulation is essential for the advancement and validation of new and existing therapies. Previous studies have suggested that dogs could serve as a viable translational model for human neuromodulation research. Experts in human and veterinary neurology and neuroscience agree that dogs offer a promising way to explore neurostimulation techniques in healthy and diseased brains. However, several challenges limit the use and assessment of non-invasive neurostimulation methods in veterinary practice. These include the need for sedation during the procedure, major breed-specific differences in cranial and neurological systems, a general lack of neurostimulation expertise among veterinary professionals, and the high cost of neurostimulation equipment. Conclusions: neurostimulation induces changes in brain circuits through mechanisms such as neuroplasticity. These effects are not confined to the site of stimulation but extend throughout the brain because of the interconnected nature of brain networks. The outcomes of neurostimulation vary among individuals and depend mainly on the differences among species or breeds, the specific disorder being treated, and the stimulation parameters. Various non-invasive neurostimulation devices are being investigated in human and veterinary medicine, offering a promising therapeutic approach for numerous neurological disorders. Although research in veterinary neurostimulation is less advanced than in human medicine, it holds significant potential for improving quality of life and therapeutic outcomes for animals with a variety of neurological disorders. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.